Committee meeting is now called to order. Chrissy, would you please call the roll?
Calling the roll, Mr. Jones.
Here.
Ms. Conwell.
Here.
Ms. Brown. Here. Mr. Schron. Mr. Schron is absent. Mr. Miller.
Here.
We have a quorum.
Thank you, Chrissy. Has anyone signed in for public comment related to the agenda?
No, Mr. Chair, no one has signed in for public comment related to the agenda.
All right. Well, how about unrelated?
Yes, we do have one unrelated public comment.
And why don't we take that
Okay,
at this time?
we have Miss Joanne Gerhart.
Good afternoon.
Good afternoon.
Oh, and it's on. As a tax-paying resident of Cuyahoga County, I see Cuyahoga County shouldering a heavy burden of health care as the Cleveland Clinic moves out to Lorain County and Lake County. This while enjoying nonprofit status and paying zero property taxes. A significant percentage of indigent care is borne by Metro Hospital in Cuyahoga County. The Cleveland Clinic's business decision to leave the city and inner ring suburbs necessarily puts an additional financial burden on Cuyahoga County taxpayers. For example, Lakewood Hospital provided $7 million in indigent care every year. Will the new hospital in Avon fill that void? I don't think so. Metro Hospital now has to fill that void at the expense of Cuyahoga County taxpayers. Cleveland Clinic colluded with elected officials to breach a lease agreement and close Lakewood Hospital. This deal was drawn up by and for the financial benefit of the Cleveland Clinic alone. The health and welfare of the residents of Cuyahoga County obviously were not considered when a hospital is closed in a tightly packed city of 52,000 people. Nobody wants to intervene on business decisions made by a private corporation. But if their actions impinge negativity on Cuyahoga taxpayers, is it not remiss to address their decision in this regard? Is it not incumbent on council to appraise yourself of this reality of the closing of a hospital in Cuyahoga County? Need to address it in a way that brings health care to our residents in Cuyahoga County and relief to the taxpayers. In Lakewood, there is a referendum on the ballot in November to reject the ordinance that allowed the Cleveland Clinic to close Lakewood Hospital. Your endorsement of this effort is one way to bring health care and relief to our taxpayers. Avoiding this issue will not make it go away. The Cleveland Clinic is engaged in business decisions that harm Cuyahoga taxpayers while enjoying the full exercise of tax benefits from its nonprofit status. The vacuum created by its exits from Cuyahoga County will almost certainly be filled by taxpayers via their support of Metro Hospital. We want your endorsement discussed at this council level. Thank you so much.
Thank you. Chrissy, has anyone else signed in for public comment?
Yes, Mr. Chair, we have Miss Liu for public comment unrelated to the agenda also.
Ms. Liu, please come forward.
Good afternoon.
Good afternoon.
Thank you for being here for all of us again. And I remember when we had a public hearing back in May for the shelter problem, there was a blog article published later on the NEOC's website. From that article, I've learned Councilman Schron had some points about this whole thing. So I would like to make that clear to all of you guys too. I believe all of you are also in some kind of business prior or in addition to these positions. If your business generates lots of positive comments and also negative ones, you will look into it. When there are more negative comments than the positive ones, then you definitely would check that out. Why? That is not what you intend for your business and for your customers, right? So this is the situation here. The situation is not for somebody to interfere a nonprofit organization's employees for no reason, because the service is already compromised, has been compromised for a long time. That was the reason why somebody like me decided to skip the middlemen, all the middlemen, to come to you straightforward, to present the problems. And I really appreciate all your help and even more help in the future. Thank you very much.
All right, at this time, I'd like a motion for the approval of our minutes from the July 6th meeting.
So moved. Second.
Moved and seconded, all in favor say aye.
Aye.
Aye. Our minutes are approved. Well, we have one item on our agenda today. It is to discuss the adoption of our Health and Human Services plan. And I would like to say I'm a fan of the long game, and Councilman Miller has been working on this for a long time. So before we have the presentation come forward, I'd like to turn it over to Councilman Miller and allow him to share with us.
Thank you very much, Mr. Chairman, and I'm appreciative of the opportunity to present ordinance number 2016-0011, and I'm hoping that when I'm done that the administration will add some comments from their perspective. And this legislation creates the framework for an ongoing health and human services planning process for Cuyahoga County. I have been very much interested in health and human services planning since the start of the new government. The HHS Transition Advisory Committee recommended such a process to complement the economic development planning process that is mandated by the Charter. HHS operations in Cuyahoga County are so large that even a small improvement in quality would save and improve lives, and a small improvement in cost effectiveness would save millions of dollars. Health and Human Services has at least three primary functions: to provide services to the least among us who are ill, addicted, homeless, infirm, or disabled; to assist our citizens to become truly independent and to fully realize their potential; and to provide preventive services to build resilience and reduce the likelihood of debilitating and costly problems down the road. Our commitment to preventive approaches is expanding under the current administration, and one of my goals for this legislation is to continue that trend in a focused and strategic way. Although I am the author of this legislation, the ordinance represents the work of many people. In particular, Executive Buttigieg's focus on the interdependence of the HHS, economic development, and workforce systems, Councilman Schron's interest in applying process improvement techniques from the business community, and Councilwoman Conwell's concern that we simplify and unify the intake process are included. Council President Brady and Council Vice President Jones were instrumental in recommending that we work with the administration to agree upon a process that both the administration and council can support. This ordinance represents such an agreement. It recognizes that it is the administration's primary responsibility to lead health and human services planning while providing opportunities for council and the public to have input both before and after the HHS plan is submitted to council. The ordinance provides a framework to ensure that planning takes place on a consistent basis while giving the administration wide latitude on how to do it. The ordinance provides that the administration will submit a 5-year Health and Human Services Plan to Council by July 1st, 2017, which Council will review over 90 days. The plan will be updated at least once every 4 years, meaning that the update will take place at the same time in the middle of the county executive's term. Each update will refresh the last year of the previous plan and extend it for 4 additional years. This process has similarities to the economic development planning process, but there are also important differences. First, the administration itself will lead the planning process rather than having it done by an outside commission. Second, in contrast to the ED plan, which we generally do not see until it is submitted to council, we envision that the council and the community will participate in the planning process prior to the plan's submission to council, and that most of the work will be done then. The ordinance provides that after the plan is submitted to council, it may only be amended by agreement of both the administration and council. Like any planning process, what you get out of it depends on what you put into it and how much you use it after it's done. I do believe that with the right attitude and attention to it, this process has great potential. We can better leverage our efforts by focusing on long-term economic and social payoff. We can improve measurement and do better at choosing programs based on results. We can respond quickly to emerging trends such as we've seen with the heroin and opiate crisis. We can simplify processes, reduce overlaps, unify intake procedures, increase collaboration, and build a unified system for our community's social and economic betterment. I would like to thank all of my colleagues who sponsored this legislation with me, and thank Executive Budish, Chief Sharon Sobel-Jordan, Chief Merriman, and Director Pristow for their help and collaboration. And I ask for the support of my colleagues to move this legislation forward.
Okay, thank you, Councilman. At this moment, Chrissy, if you would, let's officially read the item into the record.
Ordinance 2016-0011, amending section 202.10 of the Cuyahoga County Code to provide for the creation and adoption of a county health and human services plan.
Right. Okay. Do we have someone to present this? Director Pristow?
Good afternoon, Mr. Chair, members of the committee. Very glad to be here today. I and the administration are very much supportive of Councilman Miller's proposal. In fact, prior to my confirmation and during the confirmation process, I have many discussions with Councilman Miller about the need for not only a Children and Family Services strategic plan, but an HHS strategic planning process. So we're in the same ballpark, and I've read through the deliverables on the. Or I'm sorry, the wrong syntax. The sections on the document, and I have no issue with it at all. In fact, we were starting the planning process since my confirmation back in April.
Are there any questions from the committee? Councilwoman?
Through the chair to Councilman Miller, you briefly laid an outline, but what is when you spoke about that year that they would give us a breakdown of what happened the prior year and then move on with the 4, would that include a history of what was actually accomplished in the HHS? I was a proponent for in the ED plan that somewhere there should show where we came from, so as we're continuing in other individuals sit in these seats, there will always be a history of kind of about what we accomplished. So just throwing that out to you, would that be added in this, or is it already?
Mr. Chair, to Ms. Conwell, I think it would be a very excellent thing for the updates to include such a historical perspective so that we know where we've been before we talk about where we're going. Like the whole concept of this legislation, we've been cautious not to legislate detailed prescriptions as to what's to be included in the plan, and rely on the collaborative process and the administration's discretion to develop an effective process and effective document. So we don't have anything in this specifically requiring that, but nevertheless, it's very much to be recommended, and I'm sure that both Ms. Conwell and I will recommend that be done as these plans are being developed.
Mr. Chair, Mr. Miller, may I respond just quickly on that? So in order to have a really robust and significant strategic plan, you have to have measurements, you have to have outcome-based protocols, and you have to have indicators that show what are the strategies that you're looking for success, regardless of what those deliverables are. We will have a baseline in order so we can know, just as you said, Councilwoman Conwell, where we've been so we know where we're going. I mean, that's part of any intrinsic plan when you're trying to look at a monolith of 9 divisions and 2,300 staff.
Councilman Schrein?
Thank you, Mr. Chairman. In the section that talks about goals, priorities set forth, is it the intent that we will have not only measurable goals, but those circled around dollar performance and weighted averages of gains? Because, as we know, every dollar that we don't spend on the administration of Health and Human Services benefits is a dollar that we can then use to the benefit of the recipient. So I know we're looking at going into a full ERP package. This was all part of our goals and objectives. And if ever you come from a business background, you know that when we put in a program of this nature, the yield should be anywhere from 8 to 10, as high as 15% savings in the way we deliver the services. Do you have an expectation that you're going to actually be tagging this with this kind of a target and be aggressive in the dollars savings? Because if we're using things like technology and deliverables like this, we know that we should be able to deliver the services because the money is not going to be infinite. It's going to be finite, and the more dollars we can save for deliverable is that many more dollars we can benefit people.
In a word, yes, but let me explain the detail a little bit. And again, we're just starting the planning process, but we currently have a budget and planning protocol that goes in front of council every biennium. I understood we have a process, whether that meets your needs or not, but one of the things that we are very committed to doing is there's a balance between saving dollars and outcomes. We need to do both, but we need to not sacrifice one for the other. So how do we make that, one of the discussions I'm going to be having with my team as we go through this process, how do we marry those two together so that this isn't about saving dollars only, and it's not only about outcomes. It is a balance between both of those items as we go through a visionary process to our strategic plan so that each division knows exactly what is expected of them as they move forward. I hear what you're saying exactly, but what I want to be very careful about is how we go about doing that. It will get addressed, and it will meet those, because that's not only your concern, that's the concern of the chief executive, of other members of the council, et cetera. So we will address it.
Yeah, the budget process, and I'm not going to be, I don't want to intend to be offensive to anybody, but we all know that the budget process is not an aggressive program whereby you'd actually be revamping the way you do business. I mean, it really doesn't, an awful lot of the budget process does not say, what does my service need? And then let me build from zero to make sure I service it and find out what my costs are. an awful lot of the budgets are driven by what did I do last year, what are my expenses, and what's my inflationary cost, and therefore that's my budget, as opposed to what's my end game. If you start from the end game and start from a zero budget, then I don't have any problem, but I'd be willing to bet that that's not the process. So the budget is not what I see. This is more aspirational, what we have on this piece of paper, and I think that this is more in line with if you were going to run this as a business, for want of a better definition, what would you need and how would you run it, not the budget piece. The budget is a derivative of this. This is way before the budget process, is the way I see it.
Councilman?
I would just comment that I fully agree with Councilman Tron's perspective that the vision is that if done right, that this process provides an opportunity to do something that's more basic, that has a more of a blank slate aspect, that doesn't relate to the minutia of fitting programs into available dollars, but asks very basic questions about what are we trying to achieve, how can we best achieve it, how can people work better together, how can processes be simplified, how can things be made to run better, and as I said in my opening remarks, if it's done right, it will both save and improve lives, and it will save dollars, and so like the director said, I think that the vision is to accomplish both of those things, and I think it clearly can do some very significant things that we simply could not accomplish during the speed, the heat, and the excitement and the rush of the budget process, important as that process is.
Mr. Chair, if I may respond, please, or may I comment? As you know, this past biennium budget was my first one with the county. It was interesting to go through it. We are in a major shift of how we are going to be doing our HHS budgets in the future. My division directors will have to go through their programs with me and with our CFO to look at how much do you do, how well did you do it, and is anyone better off? And that's going to be our metric to look at how do we determine whether to look at the funding and to look at how we're going to go forward. We need to have a legitimate process so that it's not just the same way we've done it for the past 20 or 30 years. We are excited about marrying both the budgetary process and what do we want with the strategic planning process of where we want to go.
Yes. Well, I guess my comments would be that when you're going into this, and Mr. Miller and I have talked about this before with this idea, this concept here, and if things would have been different, I would have been very aggressive in this my own right. But I really look at this as a chance, like we all had perhaps that kids game where you pull up the sheet and you write again, you pull up the sheet, and it gives you a chance to refresh and look at things anew, because none of us use, or very few of us probably use travel agents to buy airline tickets anymore. We all go online, 1 o'clock in the morning, 10 o'clock at night, whatever suits us. None of us probably are doing banking the way we did with even 10, 15 years ago. We all do it electronically, digitally. My kid scared the heck out of me one day 5 years ago when I gave him a check and he tore it up in front of me after he had taken a picture of it and sent it to his bank. And I thought, that was one of my real shocks as to how far and how fast things are moving. And we don't buy things the way we used to. Amazon, Federal Express, and those folks are getting ready for a real shock when we eliminate both of the Amazon and Federal Express when you go to three-dimensional printing and vision graphics and all those kind of things. What concerns me is the three things you just said. We talk about what we did, could we do any better, and how did we do? Those, in my opinion, are not aspirational. Those are performance measured. This is talking aspirational. This is talking the Amazon. This is talking the elimination of banking the way we know the banking. This is talking about, do we do a better or different job of the way we deliver? And perhaps it's just a whole different way in which we talk to our client, our customer, our service provider, all of that. And that's what I really hope we're looking at this, because we really have a gem of an opportunity here in Cuyahoga County. Nobody else probably in the country has this opportunity to recast the vision of what we're going to do and how we're going to do it, and to measure how we did we do enough, did we do better than last year? In my opinion, are not aspirational. It is can we be that next, can we be that Amazon? Can we be that Federal Express? Can we be that elimination of airline travel agent and that kind of mode? I guess that's where I'm hoping you take this drive to.
Councilman Sharon, I don't disagree a bit. The only caveat I would say to that is, if you look across our contracting protocol, you're right, it is a process piece on our contracts. How much did you do? How well did you do it? Is anyone better off? We can't answer all those questions now adequately. So concurrently, we are going to answer those questions and aspirationally look at strategically, what are we going to do? But I can't build something without knowing significantly how we are doing with what we have. Culturally speaking, we are trying to shift something that's been going on for decades on how we measure things and how we look for whole population outcomes. I'm not disparaging anybody, but there's two things going on here at the same time. We have to be accountable for what we do, and we have to be aspirational in where we want to go. Both can be done, and I'm not disagreeing at all with you, but I can't. It's like taking one of the legs off of a three-legged stool. I can't propose and move forward with Councilman Miller's process and the HHS process without knowing what our contractual process and protocols are like, and whether or not the millions of dollars we're spending is actually making a difference.
Yeah, I would agree that that's where the budget process comes into play.
Okay.
Those three things you taled about is the budget process.
Okay.
That is not the vision process, and I see those.
Yeah, I think I understand.
I just see them as being different, and I really would think that this is a way, if I'm in your chair, obviously the major portion of our entire budget as a county is in your pocket, and how you do it and what you do with it and what you go with it. If I was in your, man, I would be so excited about creating a vision and actually carrying it out, because we could actually tell the world this is the way you do things differently. I think we did that pretty darn good 2 weeks ago, and we showed them how we could do something else. I think we could do something here, and it would be, I think, a fantastic opportunity to not just look at what we did inwardly, but what are the best practices? Where are they being done around the world? How can we incorporate that? Do we have the right technology? And I'd be sitting making sure that the folks in the ERP, instead of just, usually it's the finance people get the first seat at the table at the ERP, and by the way, they are the first people at the table for the ERP, that I would be making sure that the product side, and you're the product side, and I hate to be so business oriented, but you are the one delivering the product, you are the service provider, and this is really where our whole purpose in life is, as a county, is within your shoes.
Mr. Chair and Councilman Schwan, I can't be more excited about what we're doing. I mean, this is the whole nature of what HHS, this whole process has been over the past 4 months with me getting confirmed. It is a pathway for our citizens and looking where we want to be over the next 5-10 years. I don't disagree a bit, and I am excited about it.
Yeah, one of the problems I had with and I still do, with the economic development plan is it goes on the shelf, it gets worked on, and it's not an active live document.
It needs to be organic, sir.
It just needs to be moving, and it would be a shame if we came back in 5 years from now and said, wow, we did a better job of measuring how we did, making sure we got the maximum dollars out of our service providers, and boy, we serviced another 6 or 8% of our people.
Mr. Chair and Councilman Schwan, what I would tell you is that I think the plan calls for yearly updates, or I can't remember exactly what it said, but you had mentioned it earlier, Councilman Miller. This plan, when we go live, it gets reviewed quarterly. It's not yearly or every 2 or 3 years, because there are going to be measurement indicators in there for aspirational programming that we're talking about, and it has to be reviewed. That's what makes it organic. It can't be just that we do something and then sit it on the shelf and then come back to it 2 or 3 years later and say, well, gee, how'd we do? If I can't put that type of value into the document, it will fail.
And I guess I would be reluctant if I would be wrong if I didn't say, okay, I'm not even looking for 90 days, because unfortunately, that's the way sometimes our stock market is measured on 90-day performance, and that's not a good strategic method either. It's trying to take care of the shareholders on a 90-day basis, which is not a good way to do long-term planning. I would encourage us to not necessarily be micromanaging what you're doing for every 90 days, because you'll go crazy trying to perform to the report, not necessarily performing to the long-term goals.
Thank you, sir.
Director, let me, for years, we've always talked about operating in silos and the challenges of operating in silos. I know you touched on it a little bit, but tell us what impact this master plan will have on that challenge of so many departments and agencies. I've always described the county as an octopus of departments and agencies, and how it's all connected. But that almost gives a false implication that everything works, all the arms are moving in sync with one another, and that's not really the case. But with a master plan, can you speak to how we might get much closer to that idea of again, an octopus of departments and agencies that have no wrongdoer policies and are not just operating in silos? How do you see this plan moving closer to that, if that's the case?
Mr. Chair, the citizens don't care that there's a Children and Family Services and that there's a JFS and a DSAS and an Office of Child Support and FCFC. They care for the services that they want the services that they need. We build this from the citizen on outward to us, not from us out to the citizen. And since April, when I started putting together my senior leadership team for HHS, we've started that already. We meet every 2 weeks for 2 hours. In fact, every other Wednesday this morning we met. And we talk about what are the common values that we have that we can hold each other cross-accountable for the programming that we do together. I know that JFS and Office of Child Support is working very closely together. JFS and homelessness is working very closely together. CFS and homelessness, we just got a grant from DC. I mean, there's a lot of things happening that we just never had those discussions in my short tenure before being HHS director here. We are doing it, but it's not about, it almost is not so much what we're doing, but how is it being communicated to our citizens so that they actually, when they need something, that they have complete access to it and they're not running from one department to another department. I mean, look at the JFS building, the Virgil Brown building. I mean, you can't walk from one end of the building to the other because of the walls that were built. I mean, it's kind of crazy. I mean, that's just a very basic example concretely of how it was designed to not be aligned together.
I'm sorry, I didn't mean to cut you off. Go right ahead.
This is new for everybody. This system that we have had in place has been there from the county commissioners. You know, this is the first time where we have taken the opportunity to really change how we're going to do this business. I got really, really smart people working with me, really smart division heads, really smart deputies, and really smart staff. And we will get this together, but you can't change a culture in 2 seconds. It takes some time to shift that. And the way you shift it is to get people to find the value of what you're doing, and that's based on relationship building. That's what I'm doing with you as council, that's what I'm doing with providers and members of our provider community, and that's what I'm doing with staff, is to get that value orientation so that it plays out across what we're trying to do. Once we have that, we're going to be moving really strongly. But that takes some time to do that. This process that we're going to be doing with the strategic plan will help solidify that. But we will get there because it's the right thing to do. And this isn't rocket science. We're not trying to put a man on the moon or into Mars. This is all relationship building, period. In 23 years of government, that's what this is all about.
You mentioned grants. There's certainly been a challenge for some departments in seeking grants. And what do you see in this plan, vision-wise? What impact or what change to the policy, if any change, when it comes to going after grants with all these many departments?
Excuse me, Mr. Chair, part of this is what we put together as far as the HHS shared services piece. We had 8 different divisions looking at how they do grants separately. We are now in the process of looking at how we can support all the divisions under one centralized process for grant management. I mean, that's just one example of the 16 different shared services we're going to be doing across HHS that will make it easier for us to provide the programming that we need to do and also for our citizens to get our services.
Do you envision adding grant writers, or, employees to focus strictly on grant writing?
When, grant writing is on my queue. It's about fourth or fifth on the list. When we get to there and we start talking to the people who actually do it, we need to assess, do they have all the resources they need to do the job? We're going to have one centralized management process of it, but do they need more? I don't know that yet because we haven't had that discussion. It is very complicated and not easy to build an infrastructure from the ground up, and that's what I'm doing. There is no infrastructure of HHS prior to me taking on this job in April.
Okay. Any further questions from the committee? Councilwoman?
Thank you, Mr. Chair. First of all, I want to applaud Councilman Miller and all of the efforts to get this done and the support and also the collaboration with the administration. I guess my greatest concern, which is kind of to Councilman Schron's point, is this is an aspirational plan, which there is a shall, not a must. So if you guys do not create the plan as instructed or outlined, what is the outcome then? How do we move forward?
The plan will be created to meet the needs of the HHS division and our citizens. And then it will be given to the council and the committee to review and to comment on over a 90-day period, as I understand the way the legislation reads. But there is no intention of doing to not meeting the needs as outlined, not only in what Councilman Miller put together, but also in my experience as doing strategic plans for over 20 years. Failure is not an option.
With that being said, one of the items in the plan is to address the geographic needs and priorities of the departments, which brings me to the issue at Southgate. So as we move forward, are we already in works on developing this plan? Because you've been here for quite some time, and I know that one of the concerns of the community, if you say we're working from the community outward, as opposed to us telling the community, is that accessibility to services is a top priority, and moving facilities out of communities and into downtown is a concern that has been brought to my attention multiple times. So as we develop this plan, will those type of things be divulged? Will that be shared with us?
Councilwoman, I believe that if I say the communication could have been better, communication on how this rolled out could have been way better than what happened. We are absolutely going to be working with our constituents geographically across the county. It's kind of like a separate issue on whether we close or whether we don't close, but we could have done that a little bit better than what we did. And I understand that as we move forward, I will work, if this is mainly with Mr. Merriman, we will work this through together on how to get this information out and how to talk to for example, the mayor and other concerned folks as we go through a process. But we could have done this a little bit better.
And not to put you under any pressure, but just because this is an aspiration, this is a visionary plan. So I'm hoping that is something we can and will identify for the next 5 years. If the goal is to in fact have a no wrong door policy, maybe that means we have to have all of our services in one location or downtown. And if that is indeed the case, I'm able to swallow that pill and convey that to my constituents. But when, as an elected official and an advocate for the community, and I'm not clear on the vision that the administration has for delivering these services, it makes it challenging for all of us. So I just want to go on the record and know, is that something that we plan to include in this plan?
Specifically, I will say that we are committed to making sure that we have a process in place to make those type of moves public and transparent. I don't know exactly how it would be reflected in here. The issue for me is most folks, when you talk about change, they're less concerned with the what than they are with the how. And if you give folks the opportunity to discuss and determine how things work out, you generally tend to have a better outcome.
So with that said, and this will be my last point, do you consider the plan as a what or how?
Both, Councilwoman.
Okay, thank you.
Yeah, and to that, to the what and how, let me ask this in terms of how council is being impacted. And actually, I might want to direct this to Councilman Miller. At every budget cycle, this council, from the moment we were created, it's been our responsibility as the legislative branch to say what ought we to do. The executive branch executes. If we don't provide the money, they can't execute. If we provide the money and the executive doesn't want to do it, they don't have to execute. So we partner. We partner. One of the things council has done over the course of the creation of this new government is we have, at budget time, determined things that what this council has thought we ought to do. And we have had a process. Maybe Councilman Miller, in this HHS plan, how do you see the process that we already have established over the last 5 years? Will it be impacted? Will there be any changes to how we operate?
Thank you, Mr. Chairman. That's a very good question, and I think that I can address it. I had long and serious discussions about this legislation with the administration as we work together, and most of those discussions centered around how this legislation would affect the relationship between the executive and the council, and we worked very hard to maintain the principle that the administration is the lead in things that are administrative in nature, and that it's the administration's responsibility to come up with the plan. But it also provides for council and the community to be involved in the process, and not only after it gets to council. We actually envision that most of the work would be done together before the plan is even submitted to council. As it reflects the budget process, this does not change the fact that the executive submits a budget to council, and it submits recommendations for programs, and also that the council may come up with suggestions for programs or changes on its own, which we do from time to time. I think once this plan is in place, both the programs that the administration recommends in their budget and any programs that the council recommends during the budget process will be, or at least shall be, measured against the plan. And if a program is clearly consistent with the broad vision outlined in a plan, well, that would recommend the program. And if something is submitted that really doesn't relate to the plan, well, then it would be a much harder sell for that program. So I think that's what the impact might be, and I think that that impact will be greater if the executive submits the plan and the council approves the plan, which is, of course, what we hope will occur. There is also a possibility that the administration can submit the plan and the plan can go into effect without the council acting on it. But we hope that the spirit of collaboration, working together is good, and the council will submit the executive will submit the plan, the council will approve it, and then that would represent a statement that we, the executive and the council, agree on the vision. And if we have that agreement on the vision, that would be a benchmark against which future proposals on how our resources are used would be and certainly ought to be measured.
Any other questions? Thank you. Councilwoman.
Through the chair to the director, Bristol, just to follow up on Councilwoman Brown's point in regards to, and I guess this could be looked at in a general, hopefully in a global kind of, when you're doing the plan, that community accessibility to their programs or to the services are considered. And I mean, when I talk about global, I'm talking about looking at the RTA cuts and all these impacts that are going to already impact poor people. To say, you know, and I consider myself one step up, just a paycheck from that. So we really need to look at that. And I thought, if I'm going back and thinking about part of the executive's platform, he talked about community services, and he was a proponent of that being in the community. Now, speaking from the financial end, I know whatever deal we have out there in regards to that is, you know, astronomical dollars, and it's just not feasible. But there are cheaper places to rent. You know, there's different leases that you can get into. I mean, we've really, when you talk about a balance, we really got to have a balance in here, because our job, yes, on one end is to make sure the county budget is staying fiscally sound and things of that nature, but also, you know, we've built rapport with our residents, and they look at us to be kind of that voice that comes in here to the whole big picture. So we have to play a balance every day, and I'm always a proponent of what the community is getting. And when I look at that accessibility being moved away from them, that's a part that we have to learn to balance in this plan. In all regards, because downtown, everybody can't get downtown. We have disabled, we have, you know, people that just can't pay, you know, and they're the ones that need the services. So, you know, it's not in my district, but I'm putting my plug that, you know, I look at all these things as, especially with this plan going forward, community accessibility and whatever we do needs to be there. I mean, they had the, when he came on board, I think prior administration, we were kind of pulling back on some of the satellite offices with BMV, and that got reinstituted with Executive Budish. So, you know, I'm looking at that remaining on an all front. BMV affects everybody. These services that we're talking about here in this specific arena doesn't affect everybody, but you never know tomorrow who it may affect. So in regards to the way I look at it, it does affect all of us. And so I'm putting in my plug, and I will watch as this develops out to make sure that we're looking at it from a community. Those are the people that we serve. Their tax dollars or their neighbors' tax dollars that are trying to help them out, get back on their feet, and to become citizens that, you know, many of them, just because they use the services, are still tax dollars. They do work. They just happen to need the services because they're in a certain income bracket. So I just wanted to put that plug out there and say that I will be taking Councilman Miller's lead, but I'll be also watching.
I'll make a comment on that if I might.
Go right ahead.
After I came out of graduate school, the first position that I took was was as the program evaluator for the Great Plains Mental Health Center in North Platte, Nebraska. And my job was to apply the program evaluation model developed under the National Community Mental Health Centers Act and evaluate the program being provided at my center. And they had 5 or 6 criteria specified that were the basic principles, and one of those was accessibility. The idea was that no matter how good the services were or how positive the outcomes were, if people could not easily get to the services, well, then their value was greatly diminished. So I think that principle was good in the late 70s, and it's just as good today. And I'm sure that that's got to be a consideration in putting together a truly effective health and human services system.
Make a point on that. And I guess in response to that, that is a good segue to say maybe we should also look at, and I know you're looking at contracting and things of that nature, but also leases, and set a parameter of what the county is going to pay to have these services. And I bet you that the leaseholders or the people that have these buildings, they're going to want to do business with us, but we put a cap on what we're willing to pay. I mean, I think we can be leaders in that and saying that, hey, this is what we're willing to pay for this square footage, and let them do the bending a little bit.
Mr. Chair, may I comment, please? As you may remember, I'm very familiar with Nebraska, having been the state director for Children and Family Services for 3 years there. When we were going through a process similar to what we're doing here, the governor had moved to close some entities. And what we did was we engaged in public-private partnerships with libraries, with different entities out in the community, especially out in the far western reaches of Nebraska, where there's way more cattle than there are people. The resources were very, very slim out there. So I am very familiar with looking at the issue is how do we make sure that the services get delivered, and at the end of the day, the citizens can get what they're looking for, whether that's through a public-private partnership or whether it's through a standing structure that we already have. I mean, those are all decisions we need to make, but at the end of the day, the center of this is the citizen receiving the service. How we get there is a discussion that we need to have. But that they get the service and that we are responsible and have a robust protocol for that isn't in jeopardy at all from my perspective.
Any further questions or comments about this item? Councilman Miller?
Are you ready for a motion?
We are ready.
Okay. There is no urgency. We know of the content of the legislation, and as the director testified, he's already starting the process. And we don't even have the usual immediately effective clause. It can become effective 30 days after it's approved. So I simply move that we favorably refer ordinance 2016-0011 to the full council for second reading at the next meeting.
Moved by Councilman Miller, second by Councilman Schron. Any further discussion? If not, all in favor say aye.
Aye.
Aye. It has been referred. Okay, thank you.
Thank you.
Any miscellaneous business? Well, I'll take this moment to share with Director Thomas Bristow and I, we will be traveling to Nebraska. He has talked about Nebraska quite a bit, and there's an exciting project going on out there. Is this something we want to talk about, right? I've already brought it up. So.
I'd be glad to share.
Sure.
We are going to Omaha, Nebraska to a group of us from Cuyahoga County and Councilman Jones is going with us to look at the Child Advocacy Center in Omaha. It's called Project Harmony, and it's a place where Children and Family Services, investigations, police, prosecutors, and medical come together in one building to provide support and process for sexual abuse investigations. Omaha, Project Harmony is one of the premier sites across the country. Cuyahoga County is looking to decide what pathway they want to go down in order to replicate something similar here in our environment.
All right. So I look forward, that's August 15th,
Next Monday after next.
Monday after next. So I look forward to this one-day trip. The transportation is covered by a grant, is that correct?
Correct.
Okay, so we will be traveling at the
We
appropriate
leave 6 a.m. or
expenses.
from 7 a.m. to 11 o'clock at night, but it's an all-day affair.
Okay, and return that same day.
Yes.
Okay, all right, well, thank you very much.
Thank you.
All right. First, let the record reflect that Councilwoman Sunny Simon is in attendance. And Councilman Miller.
I'm aware that there is HHS legislation that's going to be introduced next Tuesday, and my question is if you have some guidance on when you're planning to hold the next meeting of this committee.
Our typical time will, again, roughly be 8 days after the
So,
next council.
okay, so it'll be the following week. Okay, great.
Any further comments? Any other miscellaneous business? If not, Chrissy, do we have anyone else who is signed in for public comment?
Yes, Mr. Chair, Mr. William Tarter.
Mr. Tarter? Oh, he's about to miss out. Five, 4, 3.
Is this my 3 minutes? You know, the travel time? No, it was good. I was getting some good clarification. So, William Tarter from Center for Community Solutions. My question is a procedural question in terms of a new ordinance that is submitted in committee and it got referred to the full council for second reading. If there's any questions from the public or clarifications on the ordinance, should those be made at the full council meeting, or will that ordinance come before this committee again?
Maybe I didn't follow. What ordinance were you referring to?
Well, the new
one
code.
today.
Right.
Oh, this is going to the next council meeting. It's on for the standard reading. It'll have 3 readings. So you'll see it on next agenda and the agenda following that.
Okay, so my question was literally kind of about the ordinance itself and how it will fit in with division goals. So how do each division's goals fit in with the Department of HHS plan that's going to be submitted in July? So I will look forward to trying to formulate some questions for the next council meeting. Thank you.
Thank you. Chrissy, anyone else signed in for public comment?
I believe Ms. Liu wanted to speak again.
Ms. Liu, come right up.
Good afternoon again. I'm very excited about today's resolution. And ladies and gentlemen up there, you guys all ask good questions. So you inspire me. I have a question too. I'm not sure if I should ask him, but you can ask him for me. Will this ordinance help everybody to understand how they do things better? Transparency. Because we just found out sometimes certain agencies, they don't really go out to investigate everything, or maybe they don't have enough time because they think they're busy. So eventually, when it comes to certain things, they tend to give out no bid contract. And this sometimes hurts all the services because no bid contract, that means you don't have multiple choices for county council members to examine, to evaluate. In that case, next year, when you try to evaluate all the measurements, is this data really helping you guys? Because you guys are busy. You guys take care of so many people, so many things. You cannot really follow up. That's why you go by the data. But as I said that before, here, sometimes the data could be misleading because if people try to misinterpret that in a way, then who are getting hurt? The people receiving service. Because one thing I learned very well from all the meetings I have attended here, you guys really teach me a lot. The budget is the issue. We have all kind of problems, but we have to distribute the limited resource to everybody as nicely as possible. So everybody will be taken care of. Yes, I understand it takes time to solve all the problems for all different things. But if the service provider or some part of service is already flawed during the non-transparency procedures, who will be able to catch them? If they are not caught, the things kept going on. The best example will be this particular shelter I have been staying in. The problem has been around 13, 14 years. That's why I came up earlier to say thank you for all your help, and we still need more help going on in the future. That's the reason why. If all the process can be more transparent to everybody to understand, then if there's a flaw, we can catch them, right? So we can put on correction to make improvement. That will be better for everybody. And that will really ensure our limited resources or our fundings are used properly to the maximum. Thank you very much.
Thank you. Chrissy, are there any more public comments?
No, Mr. Chair.
All right. Councilwoman Conway?
I just wanted to remind everybody that our dear Chrissy only has 3 days to her wedding. So this weekend she'll be, so she won't be with us next week, but she knows I have to put her on the spot. I don't have the HR committee until after she's married, so I have to utilize that time.
Again, congratulations. Yes, yes. Any other comments? Any more weddings? No? All right, okay, all good, all right.
Your house, we don't
All
have
right.
any funerals.
It's only Sean
All
Kelly,
right.
that's it,
We
right?
don't plan funerals.
He's the only one that's not.
All right, well, if nothing else holds our attention, our meeting is now adjourned.
Hey, Chrissy.